Hello, my name is Dr. Jo Bowen and I run the Exeter Stress Clinic in Devon in the United Kingdom. In this video I'd like to introduce EMDR, which is a very effective treatment for any form of trauma and also some forms of stress and anxiety. EMDR stands for eye movement, desensitization and reprocessing. It sounds a strange sort of treatment, and in some ways it is something that's difficult to explain because we're not fully sure how the treatment works. As far as we understand, it's a physiological treatment which allows for a reprocessing of trauma which is stuck in the emotional sides of the brain. Within our sleep patterns, we have a type of sleep called rapid eye movement sleep. This is where the eyes move from side to side, obviously while we're asleep, and we think that this is a way in which the brain can review the past day and the material that it might be needing to process in the sort of way that we might watch a film, slotting between our eyes like this. The EMDR treatment has about 30 to 40 years of research to back it up, so it's much evidence-based and it's approved by the NHS as a nice treatment. It really demands that a person has a lot of preparation or adequate preparation before the treatment can begin. The preparation might be that a person needs to learn how to what we call self-soothe, so that when difficult material comes up, the person having EMDR will be able to manage the emotions that arise for them. And so we are very keen to check that this sort of self-soothing can take place for someone. I think 1 or 2 sessions should be enough for this sort of help for many people coming who wish to receive EMDR. The other thing that's important about EMDR is that people understand about the effects of trauma and how trauma is something which needs to be processed. Otherwise, what happens to us is that the stress of the trauma keeps occurring to us as if it's happening to us afresh. We're unable to, if you like, date stamp it in our brain to allow ourselves to move on from the trauma, to be able to reevaluate it and its meaning for us, to be able to think differently in connection with that trauma. So that's a little bit about EMDR. When you have EMDR, you sit in a chair comfortably and the therapist sits diagonally opposite you and either asks you to follow their fingers, which move across your field of vision with your eyes, or else sometimes tapping's used, but otherwise there's no other touch used at all, and it's therefore a very respectful and treatment which usually has extremely good results. If you want to know more about EMDR, I can suggest that you look it up. There are very many websites and also other videos available about EMDR. And you can also contact me at the Exeter Stress Clinic here in Devon, where I'll be delighted to talk a little bit more with you about what having EMDR might be like here at the clinic, and to answer any further questions you might have about the sorts of other treatments that we have to help people with stress and anxiety, including clinical hypnotherapy and CBT tools, that's cognitive behavioural therapy. Thanks very much for watching, and I look forward to hearing from you if you'd like to contact the Exeter Stress Clinic. Bye for now.